Hi, this is Steve Mencher, News Director of Northern California Public Media, and I'm here with our virtual town hall, Coronavirus, What You Need to Know. And I'm joined by the people who can answer a lot of your questions. We have Dr. Sundari Mase, the Sonoma County Interim Public Health Officer, Susan Gorin, Chair of the Sonoma County Board of Supervisors, and Christopher Godley, Director of the Department of Emergency Management in Sonoma County. And I know we all woke up this morning to a headline in the newspapers that says the World Health Organization had declared that the coronavirus outbreak is now a pandemic. So I wanted to start with you, Dr. Mase. What is a pandemic?
Yeah, good question. A pandemic is an epidemic that's occurring worldwide and crossing international boundaries and often affects a very large number of people.
Okay, and I know you presented to the Board of Supervisors the other day, and you have some updated numbers for what's going on around the country and around the world. Can you share that?
Yes, I'd like to actually present some of the numbers right now. Do we have the slides up?
Yep, we're going to get those slides up right now.
Okay, great. Okay, good. So, so just for giving a global update, as of today, the World Health Organization has announced, as you said, that COVID-19 is a pandemic. There are about 114,000 cases confirmed and about 4,000 deaths, and this is all today's data. The majority of these cases are still from China, although at this time the numbers are dropping there. Outside of China, we have about 33,000 cases, and there's 190 countries that have actually reported at least one case of COVID-19. And here in the United States, let me move to our national data. We had the first case reported from a returning traveler from an area where there were reported cases on January 21st, 2020. Subsequently, the first case of suspected community transmission happened here in California, in Solano County. That was February 26th. And we had our first death reported in Washington State on February 29th. As of today, let's take a look at our California data. We had 157 cases here in California. There have been instances of transmission in California, Washington, New York, Massachusetts, and probably some other states at this time as well. And we know that here, locally, let's move to Sonoma County, we've had 3 confirmed cases. And we're very lucky that we haven't had any further cases at this time.
Okay, well, thanks for laying out the groundwork for us. Throughout the hour, we're going to be talking to you, the viewers, and we'd like you to send us our questions. And we're going to get those questions from our desk where Adia White, the Assistant News Director, is joining us. So Adia, can you share some of those questions that are coming in?
Sure, Steve. Well, thank you to everyone who submitted their questions so far. We're going to do our best to get through as many of those as we can tonight. And if you'd like to submit a question, you can write to us at viewer@norcalpublicmedia.org. You can also give us a call at 1-800-287-2722. We have volunteers here tonight who will be answering the phones and taking your questions. So the first question we have is, can the virus spread from an infected person while they are still asymptomatic? Another Sonoma County resident would also like to know how long the virus can live on surfaces and what surfaces in public places are at the highest risk for transmission. We also have a resident who says that their doctor's office was supposedly closed by the county for an exposure by one of their patients who came off the cruise ship from Mexico. Why is no information being given out? It's clear that my doctor could have exposed more people. I'm immune compromised, and this represents a real risk to me. So again, if you have a question, you can give us a call at 1-800-287-2722. Back to you, Steve.
All right, thanks, Adia. And those calls are already coming in, and you can join us on social media as well. Susan, before we answer the questions, I'd like you to tell us what the Board of Supervisors is doing proactively about the coronavirus.
We treat this situation very, very seriously. The board ratified our declaration of emergency last week, and that triggered a number of actions, including opening up the Emergency Operations Center so that we can have Chris Godley work with all of our cities and special partners, of course, working under the aegis of our public health officer, really trying to understand the threat to the community. We are constantly updating our website at the county, socoemergency.org. Please go on there for all of your questions, frequently asked questions, and links to a number of different areas that can help you get information on travelers' advisories. But our focus as board members, as supervisors, is really to be the conduit for information to the community, because just as we're receiving the questions now, our supervisors are receiving questions by the hour, and it's such a pleasure to work with these great folks here in the community to provide the latest up-to-date information.
Okay, let's get to some of those questions now. Sundari, can the virus spread from an infected person even if they're not symptomatic?
Yeah, that's a really good question. We know that we have spread of the virus from people who are symptomatic with fever, cough, shortness of breath. And we think that there is a chance that we can have spread from asymptomatic individuals. How much? We're not certain. This is a novel coronavirus, so we really need to have more data. In more time, we'll have more answers for these questions. But definitely, the more symptomatic, the likely that there's more transmission from that person.
Okay, let's talk about surfaces now. I know all of us are, everyone says, well, we're going to clean off the surfaces, we're going to do this and that, and yet we go into public places where someone else has put their hands down, where someone else has touched. Tell us about how these surfaces work to spread the disease.
Yeah, so we know that the virus can live on surfaces, and it really can be from hours to days. Maybe for a median amount of time, about 9 to 10 hours or so. And we really need to look at places where a lot of people frequent. So places where people gather, restaurants, bathrooms at public restrooms, for example, where many people come and go. And this is one of the reasons why we're telling people that are at high risk to sort of stay away from places where there's large gatherings of people, because that's where we're going to find more transmission.
Okay, and this other one is sort of personal, and it gets to the anxiety that we're all feeling. And I know we can't speak about too many things that are too personal, but it says, my doctor's office was supposedly closed by the county. These are rumors that are out there, which may or may not be true, because a patient came off the cruise ship. So why doesn't the city immediately say this is going on, or the county? Why aren't we told to take precautions? And the person who wrote in said, I'm at risk, I'm immunocompromised. How can I protect myself?
Yeah, these are all really good questions. We actually do have guidance. CDC, the Centers for Disease Control and Prevention, and California Department of Public Health have put out recommendations specifically for persons who are immunocompromised, what they should be doing, and we can go into that as more questions come up. But I'm not really aware of any situations where doctors' offices and hospitals have closed at this time. I think that the response is to treat those to test and potentially treat those that are at risk. We're trying to identify those high-risk folks, people who have been in contact with someone with the virus, people who have been traveling from areas where we know there have been many cases. And that's the public health response right now.
All right. Chris, maybe I can put you on the spot for a moment. Sure. How does the county sort of spin up its response from a month ago when we think maybe something was going to be going on until today when we know we're in the middle of what the WHO is calling a pandemic?
It's a great question, because in addition to the hazard posed to each of us as individuals and our families by the virus, there's also kind of a threat to our larger community, our culture, our way of life. And much like any other disaster, like the experiences we've recently had with fire and flood and power outages, we want to make sure that we're maximizing the capabilities of not only local government, but also all our stakeholders throughout the community, community-based organizations, our schools, our private sector organizations, the cities, everyone that's got a load and a responsibility to help us move ahead for this event. We want to make sure that we're capturing the best of Sonoma County and bringing it to bear on this issue. Not just the immediate health threat, but what might happen in the next few weeks or few months. And by having a proclamation of local emergency by the Board of Supervisors, by activating our Emergency Operations Center, by mobilizing staff throughout the county, we are doing exactly that. We're getting ready for what may be a very bad time ahead.
Now, some of these decisions, though, are made by the organizations themselves on a case-by-case basis. I just got in a note that Sonoma State is going to be canceling its next few days of classes, but they get to make that decision. At what point will you and Susan and Sundari make the decisions for groups in the county?
Well, that's a great point. We have put in place already the organization that allows for that rapid coordination, the dissemination of information, decision making, and the ability to implement those decisions quickly. So we constantly are communicating with our stakeholder partners. For example, with Sonoma State, we talk to them daily. We actually have calls regularly, not only to talk about operational issues, but even health issues. We have regular communications, and that allows us to make sure we're doing the best that we can with the best information that's available.
All right, that's great. The phones are ringing off the hook, and I want to go to Adia White again to see about some questions that you may have that have come in.
Thanks, Steve. Yes, we've been getting a lot of questions. Again, if you have a question, you can write to us at viewer@norcalpublicmedia.org. We're going to do our best to get through as many as we can tonight, but if we don't get to your question, we're going to be following up with you as best we can before the end of the week. So one of the questions we got is, how soon after exposure would a test show up positive? Do people need to have certain symptoms before they are allowed to be tested? If so, what are they? Are there any non-symptomatic people being tested at this point? When do you see on-demand county-wide testing becoming available? And how do you know how many have it in Sonoma County? Again, the number to call is 1-800-287-2722. Back to you, Steve.
All right, thanks. Now, you just told us a few minutes ago that there have been only 3 cases in Sonoma County.
Correct.
But the question, of course, is if we're not testing everyone, how do we know that that's the case?
No, that's an excellent question. So we don't really know if there's people who are infected that just haven't come to attention because they're not sick or they're not sick enough. In fact, I definitely think there are situations where people have flu symptoms and they get better. Kids, for example, seem to be doing really not diagnosed with COVID-19 as much. And so is it because they're asymptomatic and they're young and they just don't have a lot of disease symptoms? Or is it that they're not getting infected? And we won't know that unless we do a lot of testing of the general population, which we're not doing at this point.
All right, so where are we at with testing? That's the big question, and that's been the national question.
Right.
Can you tell us how many people in Sonoma County have been tested for COVID-19?
We've had, at this time, over 40 people that have been tested, and we've only had the 3
in a county
positives.
how many people live in the county?
There are about 500,000.
So 40
Right.
people have been tested out of a county of 500,000.
Right.
Is this a problem?
It's something that we are addressing. In fact, our county is taking on some active surveillance measures right now. So these people that so far that we've identified are contacts to somebody who actually has COVID-19, healthcare workers that have been in contact, or people who have been symptomatic and come to attention. What we've decided to do, in fact, right now, starting tomorrow, is to go to 4 different sites that are geographically distant in Sonoma County, 4 different clinics or ER or urgent care centers, which we've identified, and test the sequential 20 people that come in symptomatic, that have symptoms of flu, and actually test them all for COVID-19. So we're going to hopefully, within the next 4 or 5 days, have about 80 to 100 people who are symptomatic, who've come to healthcare facilities, tested. And then we will be able to answer that question of, is there COVID-19 happening in the community that we haven't picked up yet? And that's going to be very important then to inform our policies, especially in terms of our guidance for what we should do in terms of mass gatherings and other such activities.
All right, Susan, I'm sure that your constituents are coming to you from all over, your district and saying, I'm sick, I want to be tested, can I be tested? And we just found out that 40 people in the county of 500,000 have so far been tested.
Well, we have to remember that we have about 27% of our population are seniors. Certainly part of the most vulnerable population, and many of them with very serious health conditions, compromised health conditions. So I think that what we're recommending, and the senior communities really are taking the extra precautions of canceling some of the large community gatherings. Oakmont in particular has canceled a number of their large events throughout March, and other organizations, assisted living centers, are doing the same thing. in an abundance of caution. And that's primarily the questions that we are receiving. At what point do we know that we need to cancel events? And conversely, why aren't we canceling more events? And so we say, you're doing exactly what you need to do, which is pay attention to the media and socoemergency.org. Really review what our public health office is saying, what the county is saying, to take the best precautions possible and to practice the hygiene necessary, washing your hands every chance you get. But also, we have to work proactively with the community and knowing when our community members are very vulnerable and are self-isolating. And that is a very disorienting experience. Many of our seniors need help with groceries. So what can we do to practice our neighborly acts of kindness to help our neighbors be sustainable and safe in their homes?
All right, while we're talking about testing, is there a short version of taking us through what a test is? Do you spit on something? Does someone take your blood? Does you put it up your nose? How do you test?
Yeah, very good question. So basically, when someone's symptomatic, they're going to have two specimens taken. One is up the nose, and one is the back of the mouth. So nasopharyngeal and oropharyngeal. And just
with a swab of
with
some
a swab,
sort? Okay.
a swab, yeah, exactly. And just recently, CDC put out the new updated recommendation that both those specimens can go into the same test tube and be tested together. This is great because it means that each person can have one test, and we can do double the number of tests. As of about 3-4 days ago, we were doing 2 tests, separate swabs for each individual. So then once that is taken to the lab, it's a genetic test looking for the actual virus and identifying the genetic material that composes this novel coronavirus. And so we can be very sure if it's positive, and if it's negative, it's negative. So the test is really good. Now that's the test that CDC approved. We also now have commercial labs, Quest and LabCorp, as of just the last few days, that are also testing with their own test, which is also a genetic test, a little bit different than the CDC test. Now the turnaround time for these tests is about 24 to 48 hours. We can say now that in Sonoma County, our public health lab, as of last Saturday, is doing the test in the county. Therefore, the turnaround time is even better, 24 hours, and we'll have a result.
All right, Chris, if you decided in consultation with Dr. Mase that we needed another 1,000 tests or another 5,000 tests, do you have somewhere to go? Could you get them? Are they available?
Well, that's the joy of being able to bring together the people and the experience that we've accrued here in Sonoma County in the last couple of years responding to these other disaster events, because our networks are so strong. The trust among the organizations, the individuals, is profound. And so we're able to leverage that and reach out to stakeholders like the state of California and the Department of Public Health, as well as our federal partners. And we can make those requests for resources like lab test kits or personal protective equipment, and we feel sure we're doing it the right way, we're connecting with the right people, and we're optimizing our ability to get those resources.
So when you're starting this surveillance project, say, tomorrow, all of those tests are going to be available, you've
Yes.
got them in hand?
Yes, we do.
And you'll be able to test with them?
And the lab is very, I suppose, proactive with ordering the test kits as necessary.
All right, but this question that one person had asked, when do you see testing on demand countywide becoming available? I'm hearing never.
Well, we need to test those that are at risk and that are symptomatic. We don't want to test people who have no symptoms that come in simply because they're concerned that they have COVID-19. So yes, I think we need to test everyone who clinically requires a test, essentially.
Okay. And that answers the last question that someone asked, which was, do people need to have certain symptoms before they're allowed to be tested? And the answer for now is they do need to be somewhat symptomatic.
Yeah.
And the members of Congress who were tested just because they were nervous, those folks wouldn't have gotten a test in Sonoma County.
Right.
Right. I mean, yes.
I have not had a test.
Okay.
Supervisors have not
Yes.
had a test.
All right, the phone continues to ring and we have some new questions in. So Adia, can you share those new questions with us?
Absolutely. So if the staff of numerous Sonoma County supermarkets require quarantine, what provisions will be taken to ensure the distribution of food within the county? Is there a particular percentage of infection among the general population which indicates that quarantine measures are no longer viable?
Right.
Is there going to be a mass quarantine like in China and Italy? And do we need to stock up on non-perishable food items? And lastly, do local medical offices have the necessary supplies, like masks, gloves, and sanitation supplies to protect healthcare workers? Again, if you have a question, you can give us a call at 1-800-287-2722 or write to us at viewer@norcalpublicmedia.org. Back to you, Steve.
All right, thanks so much, Adia. All right, this is, what happens when folks don't show up at the supermarket to go to work? What happens when folks can't come to the hospital? The nurses and the healthcare workers can't come because they're in quarantine. What happens to our society? Maybe I'll start with you, Chris, because you must be doing some pretty intensive planning for some of these scenarios.
And we do a lot of this planning even before an event like this occurs. We call it continuity of operations. That is for the critical parts of our community, like the great question about food. What's going to happen if that supply chain gets disrupted? And so we want to work with those private sector organizations like the supermarket networks, and we've been doing that to ensure that we've got good communications, that we can maximize their ability to deliver the important foodstuffs to the right people. We're also doing work with our local nonprofit groups to identify how can we increase their capacity, not just to provide food to people that they're currently serving, but also begin to build the ability to give food to people that may suddenly be isolating themselves. And so we're looking at not only delivering food into the county, but distributing it within the county as well.
So, Susan, this might be a sort of a ramping up of a Meals on Wheels situation, or
Exactly.
making a deal with a private company like Uber Eats to say, okay, for this amount of time, we're going to pay you the same that we pay the Meals on Wheels, and can you get meals to our seniors?
And there certainly are delivery services available, and I know a number of folks who do order the fresh meals through a variety of mail order programs, but also using the internet to order meals to be delivered to their home. Obviously, the Council of Aging and the Meals on Wheels are important sources of sustenance, but again, neighbors, working with neighbors to make sure that our neighbors are fine and healthy and have what they need. We did have a widely reported outage of hand sanitizer, which is a proactive mechanism for people, but inexplicably, we're discovering that there's a run on toilet paper. We can't quite figure that out.
Well, that's the first thing in a snowstorm, or that's the
Exactly.
first thing that goes. Sundari, Dr. Mase, I thought maybe if you could take a minute or two. I know you've been on the job for a total of how many days? 2?
Something like that.
Something like 2 days. And
Right.
I wanted you to be able to share with folks in the county something about your background and the enthusiasm with which you're dealing with some of these issues that are coming up.
Sure, thank you. Yes, I'm just ready to jump in. As I've told people, I've been in public health now for the past 18 years, and I actually started my career right here in California, at the state of California, working in tuberculosis. I served as a deputy health officer in Santa Clara County before I was recruited to go to the Centers for Disease Control and Prevention, where I worked for 8 years as a TB medical lead for domestic TB activities. And then the last 3 years I've been in India, in Delhi, as the WHO TB medical officer. And I'm very happy to be back in the Bay Area and very excited to be interim health officer and jump in and try to help with the situation here.
Okay, now let's talk about comparison and contrasts, because when you mention Santa Clara County, that's a county that's having a totally different experience than we are.
Yes.
And how do you, but it's only an hour and a half away down the freeway, how do you look at something like that and say, we are having a different experience and we need to watch what they're doing, but our experience is different?
Yeah, I think it's a great point, and all the counties have to do this. There are probably reasons for why Santa Clara County, geographically, they're different than us. They have a different population mix. They have a major international airport like San Francisco. So there are reasons why they may be having a different experience. But we need to look at our own epidemiologic data. In other words, what's happening here on the ground to make our decisions. And I think that's already been alluded to. Here in Sonoma County, we don't have any evidence of transmission, community transmission. Now, what this means is,
Right, please.
I'm going to define
Good.
it. So, somebody who pops up as having COVID-19 with no known contact to anybody else. So they didn't come off a cruise ship. They didn't have a contact with a family member. And they didn't travel to places in the world where we've seen a lot of cases. Now that's what happened in Solano County, and that's what we're seeing in Santa Clara, San Francisco, San Mateo. I think once we see that, we're in a different place. Because then, as we've been talking about this issues of containment, in other words, isolating people, saying stay at home for 14 days, isn't going to be effective any longer because the virus is already out in the community. And you have to, somebody asked at what percentage of infection would you do that? Well, we're not sure, but if we start seeing a lot of this in the community, then we have to go to mitigation.
Right. So,
Yes.
Chris, maybe you can help us kind of unpack the difference between containment and mitigation.
Well, the way I allude to it is in containment, you're trying to put the cat back in the bag. And when we're in mitigation, the cat's out of the bag, running around, and you're trying to keep it from tearing up your living room. That's kind of mitigation. And in many ways, that's what we do on a daily life. We try to minimize harmful impacts to ourselves, our families. And so in this case, we're looking at comprehensive, county-wide, community-level kind of engagements to try to mitigate and protect those that may be most vulnerable. That's really going to be our focus, as can we ensure that those that are potentially up in the years or have an underlying medical condition, can we ensure that they're getting all the services and the information they need to stay safe?
All right. Now, Susan, I was noticing, I think it was yesterday, that New Rochelle, New York, a suburb in Westchester County, just north of the city, they had drawn a sort of a containment circle around it. Are we planning, if there was an outbreak here that started to ramp up, that we could contain different parts of the county?
Well, we've experienced disasters, sadly, over the past couple of years, and we are very well prepared to address any level of emergencies through communication and emergency preparations. So I have confidence that in our public health office and officer, in conjunction with our manager of emergency operations, that we will follow all of those cases that will be identified or perhaps will not be identified in Sonoma County to dictate and give us advice to the board on what actions we should be taking. So we are prepared, we are very experienced at this, and we're going to approach this with the seriousness that it deserves, but we're not jumping the gun. We're not saying, don't travel, at least locally, don't stay at home, at least locally, practice caution and use your common sense until and if we have that level of emergency.
All right, Dr. Mase, let's talk a little bit about hands. If we go on TV, the president tonight told us to make sure to wash our hands. We're not supposed to be touching hands when we meet someone. Why are hands so important in this novel coronavirus outbreak?
Well, the virus is transmitted through personal contact. So it's a respiratory pathogen, but it also is easily transmissible from one person to another just by shaking hands or by touching a surface where the virus had been. So these are precautionary methods, and preventative methods like this are the best way for us to protect ourselves. So washing the hands with soap and water for 20 seconds and doing that often. You can use hand sanitizer when soap and water are not available. Making sure that you don't constantly touch your face, your mouth, your nose, because again, these are ways in which we can infect ourselves after touching something else. So they're basic precautionary, easy to implement things that everybody should be following at this time.
All right, and then there's masks. That's the other thing.
Yeah.
The advice about masks has changed a little bit from day to day. My understanding is that if you don't have the virus, a mask is not going to help you. If you do have it, you probably shouldn't be out in public anyway, but it would stop it from spreading it in droplets. Tell us about how important masks are and who should be wearing them.
Right. So right now, really, it's healthcare providers that should be wearing the N95 masks, and they're limited in quantity. So we really do need to preserve them for our healthcare workers. Persons who are symptomatic could wear potentially a surgical mask. In fact, they may be asked to wear a regular surgical mask to protect others when they come into the emergency department or go into a clinic room or into a hospital. But the general public should not be wearing masks. First of all, these masks are often fit tested for an individual. And if they're not tested for that individual in the correct size given, then they're not going to be very effective. So at this time, I don't think there's a need for any masking of the general public.
All right, Susan, I'm sure, again, your constituents may be calling up and saying, where can I get masks? Why aren't everybody in Sonoma County being given masks? What do you tell them?
And of course, this is what happened during the fires when everybody was desperate for masks and mail ordering some masks. But I really want to emphasize the advice given to us by our public health officer. Even during the fires and the smoke inhalation, people were recommending not wearing masks unless your respiratory system was compromised beforehand. I found them to be very uncomfortable, and more often than not, I would remove them because I had difficulty breathing with a mask. So I think exercising the precautions, avoiding crowded situations, especially if you have symptoms of the flu, cold. We have a lot of colds going around. It's not necessarily coronavirus. So practice and think carefully about what you're doing, but not necessarily seeking out a mask.
Okay, thanks so much. Now I'd like to go back to Adia White. I know the phones have been ringing and we have lots of new questions.
That's right, Steve. We're getting a number of new questions into the studio. The first is, how many Sonoma County health workers are currently in quarantine or isolation for COVID-19? How many of these people were tested for the virus? We have another question about undocumented immigrants in the community who may not have health insurance. Are they going to receive treatment if they become infected? And are there any plans for a drive-through test site like they have in Marin County? Again, if you have a question, you can give us a call, 1-800-287-2722. If we don't get to your question tonight, we'll be following up with that and hopefully have an answer for you by the end of the week. Back to you, Steve.
Thank you very much, Adia. And, we got a note last week from a healthcare workers union. They said that 30 folks from one of the health service organizations here had been sent home to self-quarantine. We phoned Sutter, I can say their name. They would not confirm this. We called the county. The county would not tell us what was going on. So a two-part question for any of you who can answer. Is this the case? Did it happen? And why wasn't the news of this more widely spread? Why did we have to hear about it from the Healthcare Workers Union?
Well, let me jump in on that. This is a demonstration of some of what we call the secondary or unintended consequences of an event that's especially public health in nature. In this case, we had a number of healthcare workers that came into contact with individuals that were later confirmed to have the COVID-19 virus.
Well, just let me stop you there. There's been 3 individuals in Sonoma County. So one of those 3 individuals they came in contact with?
That's correct.
Okay, go ahead.
And so at this point, the organizations for which they work for made a decision for what we call workforce or worker safety. And so they decided, in order to make sure that the rest of the organization wasn't going to be affected, just not even taking a chance. Let's just play it super safe. We have enough staff. We've got time. Let's go ahead and give these people a chance to stay outside of the system for a while. This is an example of the containment measures that we normally undertake at the onset of, say, a pandemic event. Now, as we go into mitigation, we're going to see a lot less of those activities occurring. We're going to see people staying on the job that may have been exposed, but not necessarily are showing symptoms or have tested positive.
All right. Now, was there any particular reason why Sutter couldn't tell us that this was going on, or the county couldn't confirm it?
That's a great question. It really does come back to us as people. We have rights to privacy, especially when it comes to medical conditions and medical information. It's protected by federal law, but also a sense of morality, the fact that we want to care for one another and respect each other in a time of crisis or when we're suffering a medical condition. So as an extension of that, there are significant privacy protections afforded to individuals that have medical conditions. And so we're not allowed to really report on individuals or information that would identify an individual and associate them with a medical condition.
Well, that helps me, and I hope that is a good answer for our viewer who called in about that. The other question was one of the ones that we are particularly concerned with because our whole station is about finding out how we can promote equity in Sonoma County. And that is our goal when we come into work every single day. And so the question about what about the undocumented neighbors in our community who might not have health insurance, who might not have a doctor, how can they be treated? How can they make sure it's not going to bankrupt them? What should they do about their jobs? You know, this is a lot of questions all at once, but again, any of you who can jump in here.
Well, I do think that this is a very important question because we do have many disadvantaged folks living in and trying to survive in Sonoma County. And we know that they experienced a disproportionate impact when we had our fires and our power shutdowns. So I've been receiving a lot of questions from the service providers in our community asking me what kind of help are available for those community members. And I want to encourage any community member to seek out medical treatment at any number of our community health centers, whether you're documented or not. You can receive medical care, certainly, but this is something that the county is going to investigate more clearly. We have a very strong, vibrant tourism industry in Sonoma County, and I fear that with a curtailment of travel, that we will be having a significant impact economically on the county, on those small businesses, and especially those low-wage employees that depend and live paycheck to paycheck in our service industries. So please let us know how we can help. We will undoubtedly issue a survey trying to understand the impacts to the community, both from a health perspective, but also an economic perspective. And I was just talking with a member of our state senator's staff. Can we consider a temporary moratorium on evictions for apartments? But we're very concerned about those members losing wages that may be evicted through non-payment of rent, and how can we as a community keep them housed?
That's fabulous. I'm really glad to hear that. I know some other communities, San Jose, I think, is looking at that as well to make sure that evictions don't happen for non-payment in this time, and I would hope that we would do just as well as they do. One of the other questions was, are we setting up any drive-through testing sites? And I know I had heard from a doc at Sutter that they were going to be having people tested in their cars. But are we setting up any sites for the county?
So I'll just jump in at this point, because at this point we're not in what we call mass prophylaxis or providing medical attention in a major scale to the general population. Most folks will work through their existing healthcare networks if they have them, or community clinics for those that are disadvantaged to obtain those resources. And certainly if at some point that's warranted, that the conditions suggest that we really need to provide that service to the community in order to better address the threat, then we can certainly look at standing that up. Right now, we're looking at examining the potential for increasing medical services, in addition to what we normally get through our doctors and our hospitals, into alternate care sites and other methods for not only increasing the scope or the volume of these services, but also, as you say, drive-by testing would be new. That would be something that we could expand into if it's really warranted.
Dr. Mase, the last few days, everyone's attention has been focused on the cruise ship that's sitting there in Oakland. Right. I know some of those folks live in Sonoma County. Yes. If we have a friend, a neighbor who's coming off of that ship, tell us a little bit about the path that their life will take over the next few weeks.
Right. Well, you know, we don't know right now how many people are coming to our county, how many people actually are residents here. But those people are going to be evaluated very carefully to ensure that they don't have infection with COVID-19. They may be held at different places for a period of time and watched or treated, tested definitely, and then basically repatriated back to their homes, and hopefully very safely. And so that is the plan at this time.
Okay, and have we been asked, you know, when they bring folks to Fairfield or to other places for quarantine, do the local municipalities get pulled into planning for those sorts of things?
At this time, we have not been approached right now to house residents from other places, but we may be. And the state of California and actually the federal government, CDC, is really coordinating this effort.
Okay.
So we will hear when we know what's coming our way, and we will be there to help.
All right. Now, Chris, you were talking a little bit about the kind of brethren, men and women who do your work, emergency services work around the state and around the country. I know you're probably very intensely involved in what's going on here every day, but is there a call, a national call, where you get kind of the latest news and can tell us and disseminate it throughout the county?
Absolutely. Part of our emergency management organization is not only intended to serve our internal customers, our residents, but also remain engaged with what's going on outside of the county. What's the context for the event that we're addressing? And in this case, we're heavily engaged with the state of California, of course, both with their Office of Emergency Services as well as the California Department of Public Health, but also neighboring counties. We constantly talk to each other individually. I personally host calls for the entire Northern California region just so emergency managers can get on the call, trade notes, find best practices, and make sure that we're really in tune with each other and what's going on. Because what happens in Solano may in fact directly impact our constituents here in Sonoma County.
I noticed in one of the things I was reading today that Sonoma County is helping out its neighbors to the north. So the folks in Mendocino County are kind of depending on some of our work down here.
Well, we're relatively blessed because we have a prosperous community here in Sonoma County with 500,000 folks. We've got major institutions of learning, of medicine, of business, of private sector, and government. We're able to address many of the issues that smaller, more rural counties do have a hard time addressing. Now, they have smaller populations, but we're hopefully bringing in together some resources and some expertise that might enable them to provide an even better level of service to their residents.
Well, I think that's great that we're helping out our neighbors, and I would expect nothing less.
Absolutely.
All right, Adia, I know some more telephone calls are coming in, and people have been calling the whole time. The folks behind you look pretty busy, so tell us what some of those new questions are.
That's right, Steve. I know we talked a lot about events, but people are still very concerned about events being held, and they specifically want to know what the threshold is. Should they cancel events for 100 people? Should it be for 1,000? There's also a lot of concern about the International Film Festival, specifically in Sonoma Valley, so perhaps we could talk about that event in particular, which has a lot of people from all over. Another question, will there be standard procedures at all healthcare facilities to help protect the healthcare workers? Every hospital is doing something different. Where can I get tested if I am having symptoms? Where can I find updates after tonight? Will there be another panel to follow? And that's all we have for now. We'll be taking some more. 1-800-287-2722. Again, if we do not get to your question tonight, we will be following up throughout the week. So back to you, Steve.
All right, thanks, Adia. That's some great questions. So let's drill down a little bit into this events idea. I know I was reading today that if you have an event of more than 250 people down in Santa Clara County, the White House told them to cancel those events. I don't think the White House is going to be stepping in here in Sonoma County. But when and how are you going to make the decision about events? And let's specifically talk about these couple of film festivals coming up, one in Sonoma, one in Sebastopol.
Right, so if I can just take this. So basically, we're going to be very evidence-based. We have, as of today, put out some guidance that people should consider canceling or postponing events of greater than 50 people that involve adults greater than age 60 or people with underlying medical conditions. So we sort of preemptively decided to do this in order to be cautious and be ahead of the game here a little bit, because we do think we are going to see some community transmission over the next couple of weeks. If other counties have, we will. Now, we are not putting out guidance to have cancellation of all events across the board or health officers' orders at this time to cancel events greater than 1,000. Again, this will be determined by what we find here in the next week. And this surveillance effort that I told you about earlier is going to help us inform these guidelines and will be very evidence-based in our way of approaching this.
All right, but at a certain point, you can tell someone who's having a big concert or a film festival or something, you can say, I'm the health information officer here in the county, you're going to cancel this event.
Yeah, that'll be a legal order, a health officer's order, which, again, it's illegal to break that order.
All right, so you'll have that power.
But
Please,
I
Susan.
would like to add, because I've been on the phone today with the city manager of Sonoma, and she and I have talked about the Sonoma International Film Festival. My heart goes out to the organizers of all of these events. It's taken a year of planning to get to this point. A lot of sponsors have donated money. People have made plane reservations coming in. The county actually issues the permit for the film festival, and so we're in conversations, and there are a number of seniors that attend that. Right now, what we're suggesting is that the organizer of the events will make the decision on whether or not to cancel, because we're taking the advice of our public health officer and reviewing how this coronavirus is spreading or not through the community. So it will be on a day-to-day, every couple of days conversation, depending on what we see. But again, people who are older, have compromised health, may not want to attend those kind of events where they're in a theater with 100 or so different theater goers, film goers. But oh man, what a sad thing to have happen.
Well, think of the people in Austin, Texas, who lost $350 million that's pumped into their economy every year when they canceled South by Southwest.
Indeed.
And again, this is a guidance, it's a recommendation, and you know, as Susan said, I really think that the event organizers have to think about it and determine what they want to do. And different recommendations might be reached by those event organizers.
All right, let's continue to talk about protection. And do you have any advice that you've sent out to every doctor's office, to every hospital, about how healthcare workers should protect themselves and be protected?
There is guidance from CDC, from CDPH, from us about healthcare workers and how they should be protected. But each hospital and each facility also has its own infection control policies and guidances. And they're largely aligned, I think, with the guidance from CDC and the state. I don't know if you want to add anything.
And that extends not just to those in hospital or doctor's offices, but the men and women on the line, our law enforcement, fire, and emergency medical services, are also, if you would, reviewing their protocols for protecting their staff and for the people they serve, kind of making sure that they're looking at all best practices and maximizing those capabilities.
All right. Now, you know, as you said, this surveillance project is going to test another 80 or so people,
Yes.
20 in each of 4 locations. What's going to happen if there's 25 that want to be tested there, or 50 that show up
They'll be
at a
tested.
location?
I mean, I think that we have capacity to test more, especially some of our larger institutions want to test as many people as come. So we may actually have even more tests that we can report on.
Okay, and where can people find out, starting tomorrow morning, where they can be tested?
Well, you know, people can be tested anywhere. They need to go to their doctor and then be referred for testing. And now, as I said, we have commercial labs doing the testing. These tests are going to be widely available. So they don't have to come to our particular surveillance project to be tested. They can go and be tested if they're symptomatic,
Right.
and if they're concerned.
Okay, now we have one more round of questions that have been coming in by phone. So Adia, can you share those with us, please?
Absolutely. So someone would like to know, what is being done to protect jailed or incarcerated people in the county? Also, how much does the test cost? Can you get it if you do not have insurance? An owner of the restaurant would like to know, what's being done for businesses in the county? Are there any plans besides high interest loans? And also, can I spread the virus by touching someone's clothes? And how long should I wait between washing my hands? And someone else would like to know if there's any danger in handling money. So again, we will be following up with your questions. We're collecting everything that comes in tonight, and hopefully we can get back to you by the end of the week. We will do our best to put up an FAQ on our website, and you can give us a call, 1-800-287-2722. Back to you, Steve.
All right, thank you so much. Those are a lot of great questions. There are places where people are packed in tight. I guess the good news about folks in jail is that most of them haven't been roaming around in the community. But you must be looking into what's happening in our jails. What's going on?
Well, since I've been here for 2 or 3 days, I'm not looking into our jails
Okay.
yet, but I am very familiar with the correction system, and I do think that it's a congregate setting, so definitely higher risk for transmission of any communicable disease. So we have to align with the correction system, ensure that there's great surveillance, that people, again, who are ill or symptomatic need to immediately be evaluated, and testing may occur in the jail system over time. And we partner very closely with our correction system in public health. And so there is ongoing, and I'm sure in this county, ongoing communications between public health and corrections that are in place that allow for rapid interventions.
Okay, another question. Susan, you had more on that.
Well, I was just going to add, it's not only a concern about our jail population, but also our assisted living facilities.
Of course.
That is, sadly, where transmission happens very rapidly.
Where all these people died in Washington State.
Exactly. Whether it's norovirus or coronavirus, it is a breeding ground, and they have very stringent protocols on cleaning, and I know that they do the deep cleaning that they absolutely have to do. But that is my primary concern. Not that I'm not concerned about our incarcerated individuals, but we have a lot of vulnerable seniors in congregate living.
Are you ready to make an announcement about whether folks can come and visit if there's no particular reason to come into these facilities?
Yeah, we're not going to that extent yet,
Okay.
again, because these are precautionary mechanisms at this time. And I want to say that mass gathering recommendation is for indoor events.
Right, gotcha.
I want to just make sure we're clear
Sure,
about that.
but you're not saying that people can't visit their grandmas tomorrow and
No.
okay.
We're saying if you're sick, don't go visit your grandma tomorrow.
Okay. The cost of the test. If people, if their doctor tells them they have to get a test and they get a test, or if someone comes to one of the clinics, how much does it cost to be tested?
Yeah, I believe that per the governor now, it should be available free of cost.
And the president just announced an hour ago that he's working with the major insurance carriers that there will be no cost for treatment, let alone testing for the coronavirus, which is a significant development inside the insurance industry.
All right, now the spreading of this is something that everyone is concerned about. I can say that I went on a field trip today to one of our local stores about 2 blocks from here. I was glad that they weren't giving out any of those new the foods that they sample in the aisles. They've cut that out completely. But when I looked through the window and I saw the fella making the pizza, he's had a bare hand grabbing the pepperoni, putting it on the pizza. Are we telling our restaurants and the people who work in them that they have to change what they do? Probably the guy shouldn't have been doing that anyway.
Right.
But I'm saying in this moment, do we have advice for people who run restaurants and food service?
Well, I'm going to let our health officer respond. However, I would say that long before now, the grocery stores have been handing out the sanitizer wipes, and you can see people always wiping the handle of the shopping cart for sure. And that's how it should be, and I'm sure they scrub the doors so they know how important public health is. But you raise a good point. I would expect people handling food to be wearing food preparation gloves, and I'm a little surprised that you saw that.
Right, and on Sunday I was driving up the coast and stopped at a place where they had different sauces to sample. And again, someone else might have taken a ladle of that, and then I took a ladle of that. There was no one looking to see that every person who took a ladle had the thing sanitized. What do we do about that?
I do see that more serving lines are being served by the professional servers rather than just having a buffet line where we all help ourselves. And I think that that is the answer and response to the precautions necessary.
All right, but a little bit earlier, we were talking about how long the virus might stay on a piece of something or other. Let's talk about the something or other that we all handle all the time, unless we're only using credit cards or our Apple Pay, our money. Should we be concerned that if someone hands us a bill, we need to sanitize it or do something with it? Or
Well, it's not a hard surface. However, you certainly might consider that there could be transmission in that way. We don't know. Again, it's a novel coronavirus. It needs more study. We don't know everything about this yet, which is why there is some heightened anxiety about all these things. And now, getting back to the food service
Please.
question, because I wanted to add to that.
Yes.
We have very stringent requirements in place already for food handlers, because there's a lot of different communicable diseases that are passed through, obviously, food, So I don't think we need to change necessarily what we're doing, but that we need to adhere to what's already in place as far as our guidelines and policies regarding restaurants and food handling. So I just want to make the point that this isn't new in this industry.
All right. Now, Chris, you could go either way in the sense that there have been only 3 of the cases in Sonoma County. We're spending an hour on television. You're spending much of your day every day. Dr. Mase is spending her days thinking about these things. Are we making too much of the coronavirus at this point?
Well, you're asking the wrong guy. My job, I'm paid to be paranoid.
Okay, please tell us about your paranoia.
Absolutely.
I want to hear about it.
We can hope for the best. We can hope that, like H1N1 in 2009 was a significant threat because it was uncertain, but it ended up being relatively modest in its impact in the community. Clearly here, we're not going to see that level of innocence. I mean, we're going to have an impact here in Sonoma County in the United States. Our job, literally as leadership and public health and safety officials, is to look out for the interests of our community. And so we always have to put our money on the worst case scenario. We have to plan big and go deep into these areas where we're talking about these unintended consequences. And so in many ways, the community hopefully is going to be mindful of what they're doing, like touching surfaces or being clean. But it's our job to help build that larger organization that will respond to a worst case scenario.
All right, Susan, tell us about leadership and
But-
how important that is.
But I really wanted to recognize the strength of this community. We are prepared for emergencies. We've had to do that the hard way. And I'm amazed at the level of awareness and good questions, all the questions that we've received. People are paying attention because I think that this is both concerning to them and should be, and looking for how they can protect themselves and their family members. And that's exactly the function of the county government. Social media does play a role because we've had a lot of good citations of great
Sure.
information. Be careful of the false information.
Okay, well, I want to thank the 3 of you for joining me today. This has been really a very helpful, and I hope the community has gotten what we hoped they would out of it. Christopher Godley, Director of Emergency Management, Susan Gorin from our Board of Supervisors, and Sundari Mase, our new Public Health Officer. Very important information, and please go to our website, norcalpublicmedia.org/coronavirus. There are also other websites that you can go to, including coronavirus.gov and others, to get the very latest information. We thank you for joining us. We thank you for all your questions. We're going to be spending the next few days catching up on those questions to make absolutely sure that we can answer as many of them as we possibly can. And it was really wonderful for you to join us this evening. We're also going to be rebroadcasting this program with Spanish subtitles so that you can be sure that everyone in our community has this important information.